Okay, good.
Okay, back in session, Tillamook County Budget Committee. One department to go today, and then we'll resume tomorrow. The next up is one of our larger departments, the Health Department, so I'm assuming they're online since I don't see them in the room.
Yeah.
Hi, Darlene.
Hi, Darlene.
Hello. Can you see me? This is Marlene
Yes,
Putman.
you're loud and clear, and we're all pretty familiar with what you do, maybe with the exception of recent COVID events. So we've all got copies of everything, so go right ahead and we'll take it from there.
So I will try to see if I can share our presentation, which many of you have seen in fuller part. Let's see.
There we go.
See if I can share this from.
You might want to pop it full screen if you can.
Yeah, hang on here. Of course, per normal, I have a bazillion things up on my screens, and I apologize. Hang on 1 second. Is that better?
Yes.
Yeah,
Yes.
that looks good.
Okay, great. So I will go through fairly quickly since, as you mentioned, many of you are really familiar with the services that we provide. This presentation is a summary of services, but also a summary of revenue and expense. With me in the room, who you probably can't see, is our finance director and our administrative assistant. So they may pop in or be able to respond to questions too as we go along or at some point in the presentation. So I'm Marlene Putnam, I'm the administrator. I have my mask on because after 3 years, COVID got me, but I tested negative, but I'm still wearing my mask just for precautions at this point. All right, let's get started. So the Health and Human Services Department is a bigger department as indicated. We've been a federally qualified community health center since 1994 and was reminded by staff that we're almost on to 30 years, so we'll be doing a celebration here in about another year with a mission to promote and protect the health of all people, community members in Tillamook County. Just a lot, a description of services, again, which many of you are familiar with. We run primary care clinics that include medical and dental and behavioral health. We also provide public health and environmental health services. We try to incorporate in our services a support for our patients with a behavioral health focus along with treatments for substance use disorder and opioid use disorder with partners in intimate partner violence prevention, all supported by our health council leaders and our board of county commissioners who support the mission of our organization and department. So health centers, again, they operate under federal law. We were established, as I said, in 1994. There's now over 19 fee program requirements for health centers, but it's under federal law that allows us to continue to operate and receive federal funding, which is over $2.5 million of our funding at this point. There's requirements around quality, around cultural competence, and a lot more around services as they relate to what are called social determinants of health, or used to be called basic needs. We operate using a fee scale or sliding fee scale. So for folks that have no insurance or are underinsured or have special circumstances, they can pay anywhere from $0 to $25 up to full fee if they have no insurance and they're over 200% of the federal poverty level. Our board or our health council is a majority of patient members, which we really appreciate getting their information and input on our services. And we operate as a unique entity in the United States as a co-applicant with this board, but also with the Board of County Commissioners as partners. And we've been doing that since the beginning also, and it's been a great partnership. We look at patient-centered and integrated care. You may have heard a lot about insurance, but also about prescription drugs. and the changes that are happening with that program, because there's a limited ability now to actually, get any benefit from our prescription drug program, but we still offer it for people that can't afford to pay the full cost of their medication. Under the federal law, the section is 340B, that's why it's referred to as that, but it really is to allow us to be able to provide a lower cost for prescription drugs, that's the intention, than what other folks may pay in the public for our lower income clients. I mentioned before our services. This is just a little descriptor of basic care that we offer, including our public health things that are available every day, including our dental, WIC, public health services, behavioral health, and general health care services from 7 a.m. to 6 p.m. daily. A public health services description, those are available if you want to look more into detail around how those programs function. We also serve as the backbone and coordination for Tillamook County Wellness. There's a whole separate presentation for that, we're not going to do that, so, but we do provide regular reports on that and partner with Adventist Health and Michelle Yank, who's been our part-time coordinator for a number of years. We have several action committees, as you can see described here. We added a new one around response to weather and natural disaster-related and emergency response items this year to that group. So there'll be some more work you'll be seeing about that. We also operate environmental health from all the way from dealing with food and parks and restaurants to dead birds and West Nile virus, and so a wide range of services there. So we have 2 clinics, one north and one in central for medical and behavioral health, and we also have a dental clinic. Just a couple of shots there. Our mobile clinic, we're excited to be getting that finally out on the road for non-COVID activities, and we'll be looking to expand dental services to North and South County to start. And we're looking on school-based services in South County, along with the school district and other partners. These are some pictures of our providers. Coming soon this summer, we will have a volunteer dermatologist that will be joining our team and another behavioral health clinician. So we're excited to have those folks added along with our contracted services for behavioral health, psychiatry, additional dental services for our community. Just a shot of our dental folks in our dental clinic, and it is tight because that is a small clinic. On the far side in the glasses is Dr. Benanti, and he's been with our team now for a couple of years and is just a joy to work with and well respected and appreciated by our patients and community, along with the rest of the members of our team. Our public health folks, just a shot from during the pandemic when this team was working on clinics all the time for immunizations and testing, and received some recognition as Program of the Year in 2021. So what are the changes that are proposed in the budget that you're seeing? This is just a summary of those. So we did have an increase just a little bit in FTE. We've kept our management percent below 15%. About 22.5% of our FTE are professional technical. And then we have some clerical that includes front desk in all of our different clinical services. The FTE increase relates to what are called public health program representatives. They work in the clinic, but they also work in the field, and some temporary part-time retired and retired positions. So that's our 1.3 FTE. Our budget, you'll see a significant difference in that in the budget that you're seeing on the revenue page of 4.1 plus million. That is broken down as follows: from an increase in private insurance. There is a slight decrease in Medicaid. That's not a huge payer in our payer mix anyway, so it's around 70,000, but also a big increase in our Medicaid managed care, both for increased behavioral health, dental, and medical service provision of 1.75. And some expense increases, again, that you'll see, not probably in as much detail, but this is how we summarize it. So our general fund increase of $104,000 in our indirect allocation, $700,000 in capital outlay for remodel and equipment, $875,000 in contracted services, and around $600,000 for increases in salary, along with that 5% that we've seen, and then some anticipated increases as well in the coming year. This is just a little bit more detail around how those things break out in terms of the changes for materials and services of $630,000. This is roughly how it breaks out. So we have our county IT, janitorial services that we contract for. Ocean is the provider that we contract with for our electronic medical records for medical, dental, MyChart for patient access, and MyPax for dental imaging. And just a little for drug and vaccine updates, and then professional services contracts that we have also. A general summary of contracted services, but I highlighted these three because they're new for those of you that have seen our budget from year to year. The BrightSight psychiatric services, we're contracting for telemedicine visits and on-site consultation because our psychiatrist took another position and it's difficult to replace that. So we're doing kind of a bridge or gap service provision at this point to make sure our patients continue to receive the care they need. Similarly, Array is a telemedicine service for behavioral health. We are contracting with this organization for a licensed clinical social worker to, again, supplement our staff team while we're looking to fill those positions, working closely with our HR folks and with Columbia Pacific to do recruitment. So we're excited that we have some qualified applicants. And then the last new one that I'm mentioning is Synergy Health and Wellness. We use a nutritionist services for women, infant, and children program. It's been really difficult to find a nutritionist. So we have contracted this time with Synergy Health and Wellness to provide those services. Just for WIC at this time, we're doing a little bit of consultation perhaps with our medical team, but for now, focused on WIC. Capital outlay, there's a huge expense there because we are in the process right now of remodel and construction of our 8th Street Annex, which is right next door to our main clinic. So we're adding to a building that we purchased previously to increase it from about 1,000 square feet to 3,200. Still not a huge building, but allowing us to move some staff to increase access for our behavioral health in the main clinic and moving some of our public health and outreach programs and environmental health to this new building. So that's a huge part of this 1.1 million is that expense. We have some equipment for dental and medical and $50,000 for a new vehicle budgeted. So those are kind of the differences in some of our costs. Just a few highlights around successes. We were focused on increasing access to dental patients. We have 6,000 assigned to us as Medicaid, and we increased our reach from 1,300 to 3,000. Still have more work to do, but we're working with our contracted partners to do that, to provide that service. We have 14 metrics under the Health Resources and Services Administration that we are assigned to achieve in a 12-month period. So we're not quite done with our 12. We've had one this last year, 11 out of 14 of those measures, even during a pandemic, and feel really proud about that. We received some reimbursement for achieving those additional income on top of our grant allocation of 2.5. This other list of initials here, patient-centered primary care home, is a status of integrated care that's recognized in Oregon. There are 5 out of 4 tiers, and the 5th tier is just an additional wraparound service for outreach that we don't have staff capacity for yet. So we're really proud to be able to maintain that tier 4 patient-centered primary care home status. And last but not least, we continue to survive COVID-19 with response to the public, questions, still providing testing and answering questions about what people need to still do if they become ill with COVID-19. I was reminded also that our federal partners called us to ask how we kept our colorectal cancer screening rates so high during the pandemic. And I'll let Commissioner Bartlett but we continued to advertise and continued to do outreach during the pandemic. And we just kind of just told people it's really important, you still need to go in. And didn't ignore COVID, but said we need to push to make sure those things happen. So thought I'd share that as a highlight. I mentioned before, just a real rough summary, because I don't even know how many grants, so many different grant things we have, over probably 40. But our federal grant is about 2.5 million. We did receive in this last year the 240,000 under the American Rescue Plan for COVID and capital grant. So those have increased our budget, and public health has received additional funding for modernization related things, and some of our programs have received slight increases. So like tobacco prevention, they expanded to some outreach components, emergency preparedness, a lot of focus on communication and outreach, and that's no surprise there, and ensuring that diverse populations have access to care and that they're receiving the communication about how and where to get care and how to remove barriers. And then also a new resource, which I'm sure commissioners have heard about under Measure 110, or what's known as the Behavioral Health Resources Network, or BURN grant. Those have started and revenue has come in. We're beginning to do program development around increasing access for people to get treatment, but also providing outreach. So those are some of the main highlights around our grants. I'd like to list goals. I'm not going to go a lot into these. These are general categories that we keep over time. We're right now in the process of updating our current plan and then launching a new planning process in 2024. So just a summary of those for people who might be interested. A list of our Community Health Council members, thanks to them and to the commissioners for engaging and committing to ensuring that we have public health and primary care services for this really continue to be underserved and rural community. So that's a summary of our revenue, expense, and services. Happy to take more specific questions, and like I said, I have our finance officer here and our new admin assistant to assist us if we need to do that. And I will.
Questions for Marlene?
Chair, if I may?
Yes.
So Marlene, I've got a few questions on your revenue portion.
Sure.
Maybe just explanations would be better, that not really questions. So when it comes to Medicaid, your Medicaid reimbursements have doubled since 2021. And are you actually able to cover your costs through, we all hear the horror stories about the low rate of Medicaid reimbursement. Are you able to cover your costs pretty much with Medicaid reimbursements that you are getting?
Okay, so there's two different parts of that question. So yes, in terms of how we get reimbursed is primarily through Medicaid, but we also have other payers in the mix for our services. The federal grant funding is to offset for those that cannot afford to pay, and that does increase depending upon sometimes what we submit in terms of our total cost of care. And then we have private insurance. The worst payer, if I can say that, is Medicare.
Really?
So usually folks on Medicare are the ones that we really need to supplement their care, or people who don't have any insurance at all, that are over the income level. Okay, so that's one part of the picture. Then when you think about Medicaid as a payer, so Medicaid is about 50%, 55% of the patients we serve, so over half. When we establish with the state of Oregon our cost of care, we say, hey, these are all the other expenses and things that we're required to do by the Regional Care Organization and by you, state of Oregon. So we're giving, this is what it cost us. So we tell them how much it costs, and then the difference between what Medicaid pays and what we say it costs, we get that difference back. from the state to cover our cost of care.
Oh,
So it's a higher rate than the Medicaid reimbursement rate. It's called our PPS, or what's it called? Prospective Payment System Agreement with the Oregon Health Authority for that payment. So that helps cover like the things you have all asked about well, how do you do that? You do outreach to enroll people in Medicaid. You help people get housing assistance. You help them get access to food. You go out and visit them in their homes. How do you do that with this Medicaid rate of reimbursement? That is in part how we do it. And how do you cover people who can't afford to pay if they're uninsured? That's in part how we do it, is that PPS rate. So that's kind of a long explanation, but I'll also allow our finance officer to speak to any additional detail in that description.
We updated our PPS rate in 2012 around, and we were, during that time frame, I think some of you know what our finances were at that time period, they were able to go back once we got their approval for a new prospective payment. They went back to the first of the budget period. So we did get a big chunk of money from Oregon Health Authority at that time, which has helped us to keep our positive cash flow since 2012-ish. And we're about ready to request, with a lot of work, a new increase based on costs. It's been quite some time since we requested an increase, but I was told from somebody from Oregon Health Authority that when we did our cost updates, we were at a very high rate at that point. So it's kept us going for the last 10 or so years, and
Now we're back down at the bottom again.
well, hopefully not at the bottom. We're looking
Yeah.
into it very soon.
Yeah, I think we monitor it pretty closely. So the other factor with Columbia Pacific is there to manage the Medicaid rate so that we don't charge too much. So we have to walk this fine line staying below the costs that are allowed, and we are. So if we're below those costs that are allowed with Columbia Pacific, we get some funds back. They hold some out of the money they give us, and then later they say, oh, you did a good job, we'll give you your money back. Like, it's a big reward. But, so we have to stay below that figure, but above the figure where we don't go underwater. So, yeah, I hope that wasn't complicated to explain, but.
no, I appreciate that very much. I've got a couple other follow-ups about mine. So, your self-pay and your insurance have also doubled since 2021. And I'm one of those, so I appreciate very much seeing Dr. Brown in your clinic. He's a great doctor, and I do appreciate that very much. So I like that. The one area I don't understand, medical managed care fees, which are non-capitated. Again, they've more than doubled from 2021 to your requested budget. Can you explain what that is to me?
Trying to look at where he's.
I'm gonna let Iron explain that one.
4386 is your account number.
Yeah.
You want me to bring it up?
Well,
And if it's really complicated,
You don't know. You don't
it
know.
says non-capitated, but it looks like it has both capitated and non-capitated amounts for Medicaid managed care.
oh,
So it's Medicaid.
oh, that is Medicaid managed. Oh, okay.
So it's our biggest care through Medicaid,
Oh,
through
okay.
the Coordinated Care Organization of Care Oregon. But we get per member per month incentives for some of our quality measures that Marlene mentioned. And then we also get paid per visit.
So there's one that's fee for service, you get paid
Right.
for a visit. And then for some of the other, is it capitated, the per member per month?
Yes.
So we also might get $1 per member per month for providing
Okay.
outreach services because they're not billable. So they have doubled that by adding capitated rates for behavioral health, and they added just recently for dental as well.
Right.
So then we've also increased by over 100% the number of patients we see in dental, so that's gonna increase the generating revenue because it's by a payer
Right.
per patient visit.
I don't like to even think about being able to speak in these terms of all this type of medical care and reimbursements and how it's paid for and what you pay for, and it's beyond me, but again, I love what the health department is doing. You guys are doing great work. I just ask you to keep it up.
We will keep trying to do so.
There you go. Thank you.
Other questions? Happy to answer them.
Are we gonna be having COVID booster shots come the fall, and do we have to pay for them through our insurance? Or is the feds gonna pick it up again?
Yeah, what we're hearing is, yes, we will be billing insurance. We don't know what the rate's gonna be for those. We've heard the same rumors that you've heard around 5 times the cost, 1 times the cost, depending upon what gets negotiated. We'll be going with what the insurers provide us, and then we'll still use sliding fees. So for folks that can't afford to do it, we'll still have an affordable rate for them. We hope to just have cost, not the administrative fee to add on top of that. So boosters will be coming.
Do you know, Marlene, what percent of Tillamook County was vaccinated even with 1 or 2 over the past
Yes.
3 years? Where did it end up?
We ended up, the last time that I checked was 72%, that had had 1 or more of the vaccines. So we kind of kept adding to it, then the state stopped gathering the information also. Our target, and we thought it was aggressive, was to be at 70%. My guess is we're at 75 at this point. And as over time, if people continue to get their boosters, they can still get the initial series even now. So
how-
some people who before, they won't admit, they just said, like, don't tell anyone, like we would. We're not gonna tell their family, yes, they got the shot. And some people don't want to
Does
say that that
everything,
happened, that they, yeah. So, it's very confidential, it's not shared with the public, we just share aggregate numbers if and when we're requested by county population, as you just did.
well, yeah, that was my question in total, but how did the system work? For example, I got one of my shots at a Safeway in Cedar Hills, or I think it was, and then I got another one somewhere else. So does that all eventually filter back into the state based on your permanent residence, or how does that work?
Yeah, they send the information back and let us know who's been vaccinated that has an address, zip code within Tillamook County, so we can track county residents. We don't have to go get reports from all the places the state filtered that. I don't know what'll happen after this, now that the state's not monitoring it the same way. Hopefully they'll keep the system in place when, or boosters are available, like maybe you can still go outside of Tillamook County and get your booster at Safeway in Cedar Hills. And then that should still show up on the registry with your permanent address as a Tillamook County resident, so it should show up that way still.
Do you still have people wandering in with COVID once in a while? It's not totally gone, is it?
It's now that,
Do you still have patients coming in with COVID periodically? It's not totally gone, is it?
oh yeah, I'm one of them. So, and symptoms are very mild, so people think that they have colds, and then they'll say, oh yeah, why don't you just test me, and then find out that they have COVID. And so some people still, if they have serious health conditions, they may need to get treatment just as a preventative measure so they don't get really sick and hospitalized. But most folks who are in the higher risk categories have received those shots, or we'll get them to them and make sure that they get them after they're stable enough to get COVID shots. So still a pretty high rate of COVID testing positive in Tillamook County, even people who've had it more than once. So we're trying to encourage folks who have had it more than once and haven't had shots to get shots, so they're at less of a risk for long COVID.
Do you have off the top of your head the number of people who didn't make it? Do you know what the Tillamook County, last I heard quite some time ago, it was like 70 something, I think we lost. Was it more than that?
I'd have to like look at my report from
Well,
the
no, it's
community
okay,
update this week.
I'm just curious, you
Less
know,
than-
the range.
Yeah, it's less than 80, but above 70.
Wow.
Yeah, it's how, more than one is too many. So, I don't have any more recent data on that. But the death rate has definitely decreased, mortality rate.
What about the test kits now that we were getting for free all over? I remember I picked up one day at your office or one of the facilities here, about 200 of them, and I took them down to the Kaiwanda Community Center down south, and they were handed out, as needed or requested. Are those still available, or what? How does one get a test kit? Now, I know the federal government has, if you go on to a certain location, you'll get 2 in your mail eventually. Is that still
Yeah.
going?
That program may have ended for the federal one to get test kits. But we still are giving out test kits, and we can still request and order them. In fact, I just had an announcement from the federal government this week saying, hey, do you need more test kits? Because they have stockpiled them for a while, and they want to make sure to get those out. But if folks need them, we can also give them out to our patients or to people who would want to have a test. And just to we'll instruct people when they get them, because the test date may show it's expired, but as long as it shows a positive number in the pre-test, then you're okay. So we'll review those with folks if they need them. If you need to get more down there, Doug, give me a call.
Okay, thank you, I will. Other questions for Health Department? It's talking here almost $18 million, so.
Mr. Chair, it's not so much a question, it's more along the lines of a statement. I sit on the Health Council for the county, and I have to tell you how impressed I've been with the record keeping and the bookkeeping. The financial reports we get are top notch. They're on top of everything. The accounts receivable, aging we're ranked. I can't remember what we're ranked now, Irene, but we were ranked in the top 10 for a while, and I think now they've added a whole bunch more people, and we're still in the top third, if I remember right. So we're on top of that, and the staff, it's amazing. We could ask a question, well, why is this number off this amount? And Irene's got it like that. So I'm highly impressed. It's a big budget, and to be able to do that is impressive.
She does a great job, and there's a lot to cover. Yeah.
So what else? The budget appears to be balanced, money in, money out. It's certainly gone up due to the pandemic, and but I myself have been looking at this budget now for quite a number of years, and the people behind it, and every year I'm impressed with what a relatively small group of people, 60-some now, but what they get done around here. You all saw the list of stuff from dental and behavioral health and who knows what else, and right here in little old Tillamook, pretty darn good.
Agreed.
Yeah, it's a great team.
Thank you, Marlene and Irene. Thank you for all your work. Thank you.
Thank you for your support and your review of all this information. I know I share a lot.
Well, do we have any other questions? Last call, I guess, for the Health Department. I don't hear any, so Marlene and your staff, thank you very much. And we're at the end of our schedule for today, just a couple of minutes ahead of schedule, so that's good. So unless there's anything else to come before this committee, we will adjourn until, let's see, we're at 9 o'clock tomorrow morning, right here in this room. All right, adjourn, Pat.
Thank